Friend, I am really excited to bring you this conversation. It is a conversation that I really didn't start to explore until I was pregnant with my first child and postpartum. But this is something that as women who have a pelvic floor, who need to take care of it, we're often just not taught the basics around what our pelvic floor really is. How do we do a proper Kegel, whatever people call it, right? And how do we really care for it in such a way that bladder leaks and anything that surrounds our pelvic floor in that area is not necessarily something that we say is normal, because a lot of it isn't. All right. So I'm so excited to bring you this episode with Dr. Sheila, who is, a pelvic floor physiotherapist, health coach, TV extraordinaire. And she's just going to really give you some basic information on what is the pelvic floor, how do we take care of it, things to look out for. And then she mentions a bunch of different resources to support you. All right, so make sure you listen to this episode. Share this with any woman in your life, because no matter what stage you are in life, we all have this pelvic floor that we need to take care of. All right, and so enjoy this episode, and I'll talk to you soon. Hey everyone, welcome back to the podcast. I am excited today to have Dr. Sheila on to talk with us all things pelvic health, and in particular women, bladder leaks, and just all of the stuff that happens down there that some of us just don't realize is either normal or abnormal, or we just don't have a lot of conversations around women and pelvic health. And so I'm really excited to have her on today to talk to us. So thank you so much for joining us.
You are quite welcome. Thank you for having me.
Yeah, so I would love for you to just share more about, what you do, how you got started in that, because I think pelvic health was something that when I was pregnant with my first child, I started to look more into, and then obviously even afterwards. But since I've just been fascinated by that area of our body and just how important it is for us as women to take care of that area. So tell us a little bit more about you and your background.
Yes, I certainly can. And I'll just say, just from that comment that you just made, I am very excited that more and more women are looking for not so much answers, but even information on their pelvic health. Because back when I started this, it was really something that was foreign. People only came to us if they had serious issues. So I'll just start there. But I am a physical therapist. I've been a physical therapist for many, many years, but and I always loved doing physical therapy that was geared more towards working with women. So I started out with doing breast cancer rehab for women after they had breast cancer surgeries and some of the complications that might happen from that, including maybe lymphedema, et cetera, loss of strength. And then from there, went into doing pelvic health. And that happened actually is because I was getting women following radiation from uterine cancer, vaginal cancers, et cetera. And they were having complications besides the rehab from just the treatments and from lymphedema. So it wound up being a little bit more. They were having a lot more pain. They were having, issues. They were having bladder leaks. And so I did start the certification to then go into pelvic health. And that actually it can take a couple of years to do. There's a series of classes that you do, and then you go back and you practice and go to another class and practice, et cetera. So long story short, that is how I started doing pelvic health.
Wow, I love that journey of one, you've always focused with women, but just the journey of how it took you from cancer patients to maybe it was that just realizing, oh, wait, there's so much more that's happening down there, and then the focus on there. So yeah, I would love for you to share a little bit more about what is exactly pelvic, pelvic physical therapy. What are some of the things that you do with women when they come and work with you? And then we can go from there.
Sure. And I'll start by saying that right now I even have drilled that down and specialized a little bit more, because I do it at this point from a health coaching perspective. So I'm not in an actual clinic. I came out of the clinic during COVID, actually. So I'm going to talk about first what I did when I was in the clinic, because that gives you a better and broader idea of what we do. And I always say to women, anything that is going on with you between your belly button and right under your hips. So that would include the whole pelvic region, but it includes the abdominal region too. We can help you with. So if you have any pain, dysfunction, etc., in that region, a lot of times pelvic health therapy will be beneficial depending on your diagnosis. So I'll preface this to say, so I've treated women who, I'll start from the top and go down. Abdominals, like if you've had any abdominal surgery, and this is even for women who have had C-sections, and any other abdominal, you could have had something, you know, from your stomach or whatever. But when you have that surgery, you have some scarring, and the scarring is deeper into your, you know, it's not superficial. And so then from there you have restrictions, and those restrictions sometimes will cause pain and discomfort. So I've done a lot of work, manual mobilization, visceral mobilization, to try to loosen up the scar tissue, etc., so that there is no more pain, no more restriction. So we'll start there. Then we'll go to maybe to the pelvis. There, bladder dysfunction. So that's if you have leakage, if you have frequency, meaning you go into the bathroom every time you turn around, if you can't empty your bladder, if you have pain when you pee, bowels, you know, there's actually the same thing can happen with your bowels. You know, you can have a bowel incontinence, you can have pain, you can have things like that. Sexual dysfunction, pain with sex, unable to have sexual intercourse. Even things, for example, that you wouldn't think of, women who, there are women who have orgasms all the time. And even though you might think that's a good idea, it really is not. So this is without any warning throughout the day. We can help with that. And then of course, the pelvic pain syndromes. And I put in, you know, the hips in there because sometimes we have to do alignment. We have to make sure your pelvis is aligned with your spine and your hips are aligned. So everything is aligned so that any restriction, anything that's not working properly can be rectified. I'm going to stop there.
Yeah. Well, no, I mean, that covers
that
covers quite a bit. And I just think what you're even saying, like things like, you know, maybe like, oh, okay, when I sneeze or jump, I pee, or I go to the bathroom all the time. Like sometimes I think these things people just normalize and say like, this is just me, you know, it's just something I have to deal with. But coming to see that there could be something that's going wrong or just needs to be aligned or worked on in our pelvic floor, or even what you're saying, the abdominal, is just, it's just comforting to hear that. So I think a common thing that, you know, I mean, I probably experienced a little bit now that my baby's like weighing down on my bladder.
Yes.
But like, you know, bladder leaks is even before I had kids, you know, I just, you know, I did CrossFit. So I would jump quite a bit and doing some jump rope. And sometimes I pee my pants a little bit, you know, and so I was like, this is probably not normal. But then I ended up seeing someone who talked a little bit about different things to do with that. And so let's talk about bladder leaks. Again, we can have this conversation about different things that you mentioned, but like bladder leaks or even other things with the pelvic floor, like, you know, are they normal? I mean, obviously you just said they're not normal, but like, so what's happening, the fact that when we do have these bladder leaks, and what are some things we can do to support that?
Yeah, so bladder leaks, first of all, no, they are not normal. They can happen though for various reasons. And the two main reasons that they happen, if you don't have, say, for example, a neurological disease, because that's something that's completely different. If you have issues that are with your nerves and you know, that you just have control for, that is missing from your central nervous system. But say, for example, you're completely healthy and you begin to notice that you're having bladder leaks. It can come from mostly two things. The first thing is usually pelvic floor weakness. And don't forget, or even I'll tell you, you might not even know, your pelvic floor actually has muscles. And what those muscles do is they support, number one, they support the main organs that are there, which is your bladder, your rectum, bowel, and your vaginal canal. So they, they support all of these, and your urethra right at the top. So if these are weakened, and the main thing that stops you from leaking is a sphincter. So when you go to pee or, whatever, it stays closed until it's time for you to pee. It has to open up, your sphincter will open, everything will flow out freely. Well, what happens if your sphincter is not able to hold it? What if it's weakened? You're going to get some leakage. You're going to have some other issues that you cannot control this muscle the way it's meant to be controlled. And then I'll talk conversely. What if you are, and this happens to many, many younger women actually. What if you are the type of person who even has anxiety, or you have a tight pelvic floor? Maybe because you have pain, maybe because, the trauma, whatever. It does not have to be. There are many reasons. But so your muscles are constantly tight. And any muscle that is constantly tight cannot function the way it is meant to. It is not able to relax or contract when the signal is sent. And that will cause you to also have bladder leaks. It's not normal to leak. As you age, you're not supposed to leak. If your baby is over 6, I'll even say 9 months, you shouldn't still be leaking, because I've had women come to me and they're, I've been leaking since, I had my baby. And it's like, oh, okay, well, and how old is your baby? Well, he's 3. I'm like, oh, no. You address this a lot earlier, because you don't want to then get into that subset of being older. And even if you're older, I mean, probably 70s, 80s there. If you start having mobility challenges, and then you're leaking and have to go into, using protective pads, etc. You want to get a handle on it. It'll start, your body will start to tell you when you have those couple drops. And then if they become more frequent, if they become more regular, because everybody's, I can't say, if you had a few drops in your lifetime, oh my goodness, you need to go to PT, go see your doctor, etc. I'm not going to say that, because, you can have a full bladder, you can't get to the bathroom, something is hilarious, and a couple drops will come out and you can control it. But if that happens every time, that's when you need to go and seek help.
Yeah, I love that. So it's basically what you're saying, that you could either have, your muscles could be like too loose or too tight. And that could kind of lead to what you're saying, the bladder leakage. And I love how you even talked about, like, again, just addressing it early, and versus waiting and just getting to a point where maybe it's going to take longer to kind of strengthen it. So what are some of those things that you have told, when you've worked with women to really help them in general? I mean, obviously strengthening your pelvic floor is going to do a lot more than just help with the bladder leakage. Is going to help with other things. But what are some of the things that we could do to strengthen our pelvic floor, take care of it, either in our everyday lives, or even if we were to go to see a physical therapist? Or what are some of the things that are typically suggested?
Okay, that was 2 questions. So I'll take the second one first, because you asked if you go see a physical therapist, what is suggested. And I'll take that one first, because if you go to see a physical therapist, that means that you already have a concern. Because I want to talk about if you have a concern, and if you really don't have a concern, what you should do to avoid. So if you have a concern and you're going to see a physical therapist, particularly for bladder leaks, what we would do is assess why, because there are many reasons why that could happen. And then from there, teach you how to do a proper pelvic floor strengthening. Because the problem, many people will say, my doctor told me to do Kegels. I did them and I am no better. And funny, when I was in the clinic working, we test most women's strength when they come in for bladder leaks. And you test it manually. So if you ever have to go to therapy, and you know that they're going to test your strength, they take a glove finger, put it into your vagina, and then have you do a few things so that we can feel what the muscles are. We can feel what your endurance with, etc. So we get a good feel for what's going on in there, with tactile sensation. But that being said, so I would say to women, because they would come in, I know how to do a Kegel, so that is not my problem. Okay, so we would get on the table, I would go ahead and start to do the test. I would say, okay, well, go ahead, do a Kegel. Let me see what you have, because you've been doing them, so let's see how much strength you have. I would feel nothing, meaning no, but they would hold their breath. They would squeeze their legs together. They would be clenching their buttocks as hard as they can, thinking that they were doing a Kegel and doing pelvic floor strengthening. And of course, hitting none of the muscles that you need to use for control. Yeah. So the first thing that's the first thing, and then we would, correct that and then correct some of the other things. Because usually once that happens, there's other things. You wind up going to the bathroom too often, you leaking at night. There's, once you start, there's a couple other things that accompany your bladder leaks, because, your bladder leaks don't want to be there alone.
Right.
Yeah. So, but if you don't have to if you haven't gone to therapy, if you notice you have a couple leaks, if you just want to keep your pelvic floor working the way it should, make sure that you are actually doing a pelvic floor exercise that strengthens the correct muscle. So instead of just thinking, okay, I'm just going to keep squeezing and squeezing and squeezing, you're going to take your time. And when you do that squeeze, you're also going to see if you can feel a lift, because you want to squeeze and then lift those muscles up. You're going to just lift them up towards your head. They're not going that far, of course, but you want to be able to feel a lift and to be able to hold that. There's, you do the quick ones, because that'll stop you from leaking when you cough, sneeze. But don't forget, these are support muscles also. They have to keep your organs and keep everything up where it should be and in place. And for that, they need a strength of the longer twitch fibers. So when you're doing your lift and squeeze, think about holding it for 8 to 10 seconds if you can, and do that 10 times each. It's not that easy. So if you're doing it and you're saying, because even for me, and I've had my strength tested, I know it's, a 4, that's pretty good. But even for me, if I'm doing 10 second hold, 10-second rest Kegels, my pelvic floor, my muscles will tell me towards the end, oh my goodness, you did a little bit of a workout. So if you don't feel that, then you really, really need to hone in on how you're doing that exercise. That's probably one of the main things. And if you're doing it or you really can't feel anything, I would start out with doing diaphragmatic breathing and relaxation into your pelvic floor, because you might have an issue with tightness.
So very helpful. And I'm just so glad I actually know what you're talking about at this stage of my life. But I'm very grateful, because it's like I was a part of a fitness program that I did and I'm doing this time too, that was really focused on helping pregnant women, throughout their pregnancy. But then also there was like this postpartum bundle that they had, and they talked a lot about, that diaphragm breathing. And I just remember after having my daughter, like the first 4 weeks of it, they're like, you're just going to breathe. Like they're like, we're not going to make you try to you shouldn't, you need to heal. But I just remember like those breathing exercises and what you're saying. I'm like, wow, this is like, it's a workout, because it's like, it's just really working a lot of those muscles and stuff. And so grateful for that. And just how like my core and my pelvic floor was strengthened because I did a lot of this stuff that you're saying. But you're right. I remember when I first got told do a Kegel when I was pregnant, I was like, what am I supposed to squeeze? Is it my butt cheeks? Is it my legs? And but as you were talking, I'm like, I'm gonna practice this as she's talking me through this. I'm like, oh yeah, the lift. Like, when you feel that lift, and when you feel that, and what you were saying, when you hold it for a while, it's like, this is like holding, a rep in when you're working out. Like, this isn't like just like nonchalant, like passive stuff. It's something you have to work on,
Yeah. And that's a really good point, that you should do them with some type of intention,
right?
As opposed to just nilly-willy doing, because you can't even keep track, number one, of what you're doing.
Right,
when
right,
you're not focusing on it. You're not focusing on timing, you're not focusing on quality.
right,
And it's more quality, which you hear from many, many things, but it's quality over quantity
right.
that makes a difference when you're doing your strengthening.
Yeah. Yeah. And I love what you're saying, doing with intention. So, you know, part of my daily kind of routine even is just like trying to like do stuff like, well, a few times a week, as much as I can remember, do stuff like this. And just like I would carve out time for a workout, carving out time for this pelvic floor, this this diaphragm breathing and all that, and seeing that as an integral part to my overall health and fitness routine. Right.
Right. Yeah. It does not take that long.
Right.
And you don't have to do it you actually don't have to do it every day, especially if you're doing it as a preventative measure.
Right.
You can do it a couple times a week and still have that, the effectiveness. If you do it more if you're having an issue.
Right. 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 So good. I love all this tips. So, so say if someone's listening and I mean, what do you basically like, this is something you specialize in. You saying you're coming more from like a health coaching perspective these days. Like, say if someone is either wanting to do, proactively, like just I want to work on my pelvic floor or has some issues, like what are some of the things that you offer, whether it's free resources or paid resources to help women in these areas?
Well, if you're interested in really understanding a little bit more about the pelvic floor, I do have a free presentation that you can actually watch online through my website, which is thepelviccoach.com. But you would put thepelviccoach.com/free.
Right, right.
Because I'm offering it for free right now. During this, I have a promotion I'm going to do for a couple of months because I really want for, women to get a little bit more information. So you can go to thepelviccoach.com/free and you can watch it. You can sign up for the presentation/webinar.
Nice.
And that gives you information. It also has a little section in there that really give you coaching on how to do a Kegel correctly. So that's beneficial for a lot of women. And then I've written 2 books. And I actually have to put them both on the same site, but they're not. So if one of them is more of an introductory, what is bladder leaks, and it has actually the actual programs that you can use to help if you have bladder leaks. That one, and I know I gave you the link, so
yeah, you did.
You can just put them in. But that one, that landing page is 2P or not to the number 2.com. Yeah, and that book is to P or not to P.
Yeah.
And then the second book, you can get that off of my website, thepelviccoach.com.
Wow.
Yeah.
So many great resources.
Yeah. I also have a YouTube channel. I put a lot of information on each thing. So the website has different blogs, different information. The YouTube channel has little short videos that you can watch. Why am I leaking at menopause? Why do I leak and laugh? Things like that. So that's on there too. So yeah, there's a couple of ways that you can find out information through me. And then if you have an issue with bladder leaks and you want you really want to see about getting some help, after you watch the webinar, you can apply to work with me.
Okay. Yeah. I like that. I like that you have the webinar where it's like, people can come in, learn a little bit more, and then take that next step with you by applying to work with you.
Yeah. Because you want to be ready to take the next step.
Right.
Because you don't want to, go ahead and try to say, okay, well, I'm going to do this. And then it's not your time. You won't get the result that you want. Right.
I love that. And you also have your own podcast as well.
I do. It's actually it's a streaming television show. So it's on a lot of Roku, Amazon, Google, and we're getting a couple other stations lined up. But yes, I do have that. Living Well with Dr. Sheila is the name of the show. And that comes on, it's live on Thursdays at noon Eastern time on the KP Media Network. And I think you have that link also.
Yeah. I should have that.
Yep. And then you also do have the link to watch it on video on demand, because Brianna was nice enough to be a guest on my show.
Yeah, I know.
So I got a lot of great information from her. And hopefully audience, when hers comes up, we are still in contact, and you can listen to her show also, or you can watch her show.
Oh,
Because you'll
that's
be able
true.
to look
Right.
at her.
That's true.
Yeah,
The video.
you can look at her. Yeah.
Yes.
So
Yes.
yeah. So you'll miss it because it was really, really good. So I
No,
appreciate that too. Thank you.
no problem. Thank you. Well, I mean, again, I'm probably going to have to invite you back because I just think there's so many different things we could talk about around the pelvic floor. But I love what you were even talking about, focusing on like, either if you have an issue to go and get that support, or if you're trying to be proactive, but either way, we want to make sure we're doing whatever we're doing right, specifically Kegels, because every woman has probably heard about them at one point in their life. And I just love how you even talked about the benefits of them, right? And the intentionality. So thank you so much for sharing with us. I can't wait to share this episode with everyone, but is there anything else as we wrap up that you would like to share with the ladies listening?
The one thing I would like to share is that really pay attention to, I don't want to say pay attention to your pelvic floor, because that is ambiguous and really doesn't make sense. But pay attention to if you're having any symptoms of bowel, bladder, sexual pain, sexual discomfort, because none of those are normal. And if you're having any issues, seek help. Don't wait, because I'll leave you this. The average woman waits 5 years before they seek help for their pelvic floor issues.
Wow.
That is unless it's something very serious, of course, but that is way too long. We have to stop putting everyone ahead of ourselves and really focus on us being the healthy person also.
Right.
Yeah. So I do want to leave that, because there's no reason for us to just keep waiting and waiting, until you leak through your clothes, or until, you get something happens that's catastrophic, because that's when we see people.
Right. Exactly. So great. Well, thank you again so much for joining us. Everyone, make sure you check out the links, because Dr. Sheila has so many great resources for you to check out. And as she said, like, even if it's whether it's watching her free webinar, listening to her podcast, just even learning how to do a Kegel, like, just get started and don't wait 5 years. And let's just start caring for this area that is actually very special for us as women, and that we just need to take care of. So again, thank you so much, Dr. Sheila.
You're quite welcome. Thank you for having me.
Of course.
I hope you enjoyed this episode with Dr. Sheila. I hope you go and follow all her resources and really start to care for your pelvic floor. Please feel free to let us know on Instagram or Facebook, even via email, how this episode was for you. As always, please leave a review, because the more reviews that we have, the more women can be introduced to this show. I have a heart to see women be healthy and thrive in all areas of their life. And I think that starts with mindset, habits, oils, and a nourishing life. And I think this is a conversation that we just don't talk about, right? Yes, we can do all the healthy habits that we want, but if our body is not being supported in the unique way it needs as women, what's the point? All right. And so I'm just so grateful that you're here and listen to this episode thus far, because this is a topic that, as a new mom, I am really just grateful for, that there are people who are really, making their foot in this space. Okay. So check out all Dr. Sheila's resources. Make sure you reach out if you're wanting support in your health and your life from a holistic point of view from me. Book a clarity call and we'll go from there. All right. I'll see you on the next one. If you have been struggling to really find peace with food, to recognize that your worth is not in your weight, to really create healthy habits that are sustainable and life-giving, and want to create a nourishing life for yourself where you're healthy and whole in all areas of your life, I would love to invite you to one of my More Than Your Weight health programs. This is a holistic health program where, whether you're doing the 90-minute session or you're doing the 6-month program, it is a space for you to get very clear on the areas that you want to work on, and together we can work on those, whether that again is the mindset piece with food freedom, your body, your worth, your weight, and then actually creating healthy habits that support you in your health and your goals. But then starting to see that once you as a woman take care of your body, there's other areas of your life that need nourishment and attention as well, so to create that nourishing life. And so if you're interested in really getting healthy and nourishing your whole body, your whole soul, your whole mind in a very holistic way, please book a clarity call. This is a free complimentary call where we can just talk about your dreams, your goals, your ideas for your health and your life. And then together, on the call, I can really just share with you how I can uniquely support you in that. All right. So please book that clarity call, find a spot in my calendar. If you don't find a spot that works for you, please reach out and email me, or reach out on Instagram at MadeWellWomen, or even on Facebook. And let's get together and just talk, because it is time. It is time that you see that you're more than your weight. It is time that you recognize your worth and your health is more than your weight, but also that you can step into the woman that you've been created to be through caring for your health in your life. All right. Hope to talk to you soon, and enjoy this episode. That's it. I hope you enjoyed this episode of the Made Well Women podcast, and enjoyed whether it was me and a solo episode or my guest thoughts on really how to help you live a healthy life and to be made well. But before you go, I want to make sure you know you're not alone. These podcasts are meant to be inspirational. They're meant to support you as you're going about your daily life. But where I have found the most transformation is one-on-one support, but also community. So make sure you join the Made Well Women's Health community, where you can process this podcast and get support in whatever aspect of a Made Well journey you're on. And also make sure you follow me on Instagram, because there you're going to also be able to see behind the scenes and just how I live my own Made Well Woman life. All right. Can't wait to support you. Can't wait to get to know you more. And again, thank you so much for listening to this podcast. Please rate, review it. Let me know how it was for you. And the more people that rate and review the podcast, the more women that could see it. All right. That's it. Bless you. And I'll see you on the next episode.